Good afternoon and welcome to How Can Your Organization Embrace Children's Environmental Health? Lessons Learned and New Resources for Childcare and Public Health. We're excited to be hosting this webinar. While people are getting logged in, I want to go over just a few quick tips for making this webinar successful. First, on your screen, you should be seeing our opening title slide. Next, you can hear us, but we cannot hear you because of the number of people that will be on the webinar. We are not able to unmute attendees so that they can verbally ask questions. But throughout the webinar, we request that you please ask questions in your question box. We will do some general questions in between each one of the presenters, but most of the questions will be answered at the very end of the webinar to allow time for all of the presentations. So we're very pleased to be hosting the webinar. Again, for those of you who are new to webinars, remember that the best way to ask questions is through your question box. The next thing to note is, depending on your internet speed, at times, if you're unable to hear me or one of the presenters and we sound either computer-like or there's a delay, it may be best to switch from your computer speaker system to your telephone, and you can do that by pushing the audio button plus sign and dialing in through the telephone. You will still be able to see our slides on your screen, but the sound may be more clear on your telephone. Before we get started, I want to go ahead and just do one more quick sound check. By a show of hands, if you are on the webinar currently, can you hear me clearly? Great. The second request I have, especially for those of you who are comfortable, if at any point in time you feel like what you are seeing on the screen is not what you are hearing, or if our sound becomes distorted because we are going to be switching presenters, please send us a quick chat. We do have some supports in place to make sure that the webinar goes very smoothly and that everyone can hear throughout the presentation. So we would appreciate any feedback that you have regarding someone's sound. The great thing about webinars is that our presenters can be all around the country, and you will get to hear about the various activities that are taking place. But that may mean a difference in sound quality depending on who is presenting. So please provide us feedback, because that will allow us to immediately make adjustments if necessary. We're going to take a few minutes to do a quick poll to see who is on our call right now. So we're going to launch that poll. It will be up for about 1 minute while everyone is still logging in to be ready for the webinar. You should be seeing a poll on your screen, and we're getting people to answer. Please go ahead and answer that poll so that we know who is on the webinar. We're going to keep the poll open for about another 10 seconds or so. So please, if you haven't voted, go ahead and click so we know who is on the screen. Who is on the call. And then we'll show the results on the screen so everyone can know. All right, we're going to go ahead and end the poll. So as you can see from the poll, 24% are child care providers, 22% are child care professionals other, 39% is public health, 17% government, and 20% nonprofit. We're very excited to have you all on the call, and I'm going to turn over the webinar to our host, Nsé from the Children's Environmental Health Network.
Thank you so much, Tracy. Colleen, excuse me. Good morning or good afternoon to all of you, depending on where you are in the country. And we really appreciate your time today in joining us on what we do believe will be a very fantastic webinar for you on how your organization may embrace and incorporate children's environmental health lessons and to highlight some 3 wonderful case examples in the child care professional communities that might be very helpful for you to know about. Again, I'm Nsé Obit-Witherspoon, the Executive Director for the Children's Environmental Health Network. My background is in public health, specifically maternal and child health. So welcome. Our 3 speakers today, I will introduce all of them individually as they speak, but Marcus Williams, Colleen Tracy Haddad, and Jean Chimino will all be our fantastic speakers today, and we welcome them. We especially want to give a big thanks to the Association for Early Learning Leaders for also being our technical host today on this webinar. So the Children's Environmental Health Network, just as a quick background, I'm going to give you a little bit of background on the field of children's environmental health before we then pass off to our speakers. We are a national nonprofit organization that has been science-based and has been around and working in the field for over 20 years. And our mission has been the same, to protect children from environmental hazards. Our objectives for today are to talk a little bit about children's environmental health, certainly building organizational capacity to better address children's environmental health issues in a variety of organizations, lessons learned from this specific project that we were embarking on this year, and then new resources for improving children's environmental health in early learning and learning environments. Children are not just little adults, so why the focus on children? We focus on them because all their systems are still developing, which means that they have windows of vulnerability when these systems can be harmed. Adult systems are mature, so they're not as vulnerable, and for a variety of reasons, if there are contaminants in our environment, children are likely to be exposed to those contaminants at a much higher amount of levels than adults may be. So to quickly summarize, children may be harmed for life from an exposure for an adult, whereas an adult may have little or no harm. Next slide, please. Next slide, please. Today's children, with all the vulnerabilities that they come in contact with, as I just summarized, are living in a world that is much different from previous generations. They are exposed to thousands of chemicals that did not exist 50 or 75 years ago. We find trace amounts of hundreds of chemicals in our bodies, yet we do not have adequate information to know what the impacts on our health actually are. This is especially true for children. Though we have some health impact information, it is most commonly from studies on adults, not, again, children. As I just mentioned, adults' mature systems are not as vulnerable to harm as a child's, so we cannot be sure that we are adequately protecting our children's health. Next slide, please. So we don't have time today to go into much detail, but I'm happy to share with you offline information about the emerging research that is raising troubling concerns about the impact that some chemical exposures are having on children's health and their development. We do, though, have lots of evidence that a child's environment plays a role in today's pediatric epidemics of asthma, learning disabilities, autism, and obesity. And because they are likely to have many years of life ahead of them, children have more time to develop diseases with long latency periods that may be triggered by an early environmental exposure or a group of exposures, such as in cancer or in Parkinson's disease. The evidence is strong enough that we are seeing health experts address children's environmental health exposures through policy statements such as these. The American Academy of Pediatrics and the American Lung Association have both weighed in on chemical exposures in general and the Academy on Preventing Children's Exposure to Pesticides where possible. And since there are so many children spending so much of their time, 60% or more, in early learning care and learning environments, obviously the setting is a very important one for us to focus on regarding environmental hazards and exposures. We looked into the level of awareness and action in this field and found that, with few exceptions, environmental health was not comprehensively addressed by early care and learning institutions. And of course there are some exceptions, but they are certainly just a few. So that is why we run the Eco-Healthy Child Care Program, also known as EHCC, which I'm not going to talk about at length at this point, but it does support much of the work that you will hear about today. And you can go to our website here. Next slide, please. www.cehn.org/EHCC to certainly learn much more about that program. Next slide, please. This need for action was also the reason why we focused on early care and learning organizations this year in our Health in All Policies cooperative agreement with the Centers for Disease Control. Earlier this year, we issued a request for proposals for projects that would build capacity in national organizations to advance best practices in environmental health in the child care setting. These 3 organizations qualified, and I will leave it up to them to discuss the process and the outcomes, other than the fact that they all came up with the excellent ideas and have been working diligently. This has been a great experience for us. We are very grateful to them, and we are grateful to the Centers for Disease Control for making this all possible. We plan to request proposals for next year's work as well, and we can discuss the process more in our Q&A. But for now, let's turn to our presenters. Our first presenter is Marcus Williams. Marcus is the Executive Director of the National Association for Regulatory Administration. A seasoned nonprofit executive, he has worked closely with government agencies, universities, private corporations, and associations over the course of his career. Mr. Williams' professional experiences include serving as a management consultant to nonprofit organizations, managing a federally funded prescription drug monitoring initiative, and directing an emergency foster care project for a consortium of child welfare agencies. Mr. Williams is a native of the District of Columbia. He holds a Bachelor of Arts degree from St. Mary's College of Maryland and a Master of Arts from the Catholic University of America.
Insay, thank you so much. Good afternoon and good morning to everyone. Again, Marcus Williams, Executive Director of NARA, and I want to spend just a little time talking a little bit about NARA, who we are, and then talk about our journey through this collaboration. NARA is a membership association, and our members are both within the U.S. and international. And our focus is on promoting quality and excellence across the complete spectrum of human care. 2016 will be our 40th anniversary in terms of our advocacy, and we focus on the areas in terms of, again, the complete spectrum. So our focus goes into adult care, child welfare, developmental disabilities, and mental illness. We think that we best achieve our goals by focusing on strong licensing regulations on the state and local level. Our members include regulatory professionals, who are the primary thrust of our members, academics, consumers, providers, and concerned citizens across the board. Next slide, please. Our members have access to a broad spectrum of benefits, but I think 4 in particular I want to highlight. One is our policy webinars, which focus on national trends in child care and child welfare, in which we focus on what's being done on the national scale. We also have our monthly newsletters, and our newsletters are focused more on the states and the particular regulations and movements that occur within the state and local jurisdictions. We do a lot in terms of offering our members best practices and cutting-edge research across the complete spectrum of care. And then the vast majority of our time is spent in terms of education and training. And this occurs basically in 3 areas. one being naturally the professional development of our members, our regulators, enhancing their skill sets. We work a lot with states across the country in terms of improving and having their regulatory framework, training their staffs on best practices. And third, our signature initiative is our annual licensing seminar, which we do every year, which we'll be doing again starting September 29th, in which we bring all of our sort of stakeholders together to see what are the current state of things in terms of practice. So that's a little bit about NARA. Let me talk a little bit about our journey throughout this collaboration. Next slide, please. Thank you. So when NARA engaged this collaboration, we had just finished a strategic planning process, which is for 2014 through 2020. And so one of the things that attracted us to this initiative was that the issues of environmental issues in care was not a part of our strategic framework. And so in terms of engaging this initiative, one of our first challenges was to see how do we connect our established strategic framework with the goals and objectives of this program. And in working with our executive committee and our board of directors, we identified two high-level strategic goals, which we think connect with this particular initiative. And then from there, we went to develop some sort of tangible strategic initiatives. The two high-level, which are there on the screen, is one, promoting high-quality human care regulations and facilitate system improvements by 2020, and this is both on the state level in terms of regulations and processes, but also looking to get more action and more movement in terms of improving care on the federal level too. And this is one of the initiatives which we think helps us achieve that goal. And the second was developing our leaders in terms of professional development. So those were our two high-level goals. And with that, next slide, please, we developed three areas in which we think we can develop and are developing tangible concrete initiatives. So first was to look at our annual licensing seminar, which again is our signature program. We have a presentation coming up at our seminar this in a couple of weeks, which focuses on these issues. And so our first things in terms of highlighting the strategic importance of this was to have our board and our seminar committee look towards developing an actual session track for our 2015 and 2016 annual licensing seminar, which focused specifically on environmental issues in out-of-home care. And so in terms of, again, that's our signature initiative. That's what we're known for, and we think having that as its own track will highlight this issue for us nationally, but will also help us in terms of facilitating professional development among our members. So it's a real concrete commitment on behalf of NARA. The second thing we want to do, and again in terms of helping to educate our members in this area, was to implement a quarterly webinar series focusing on environmental issues in out-of-home care. What we've done, we have webinars which occur each month, so sometimes a couple times a week, but we think that in terms of highlighting this on a quarterly basis and having issues surrounding environmental issues on our webinar calendar, again, highlights where we're going with this, highlights that this is something of strategic importance, and again, gives our members tools to advocate for this within their own states and local jurisdictions. Next slide, please. NARA is also moving in the areas of advocacy. We have, again, most of our position pages or issue briefs have not dealt with this issue of environmental health, and so our incoming president-elect, Ron Milewski, has pushed us to start developing a position paper and an issue brief specifically in this area of environmental issues. We're also going to look to develop through our committees and our members, a set of best practices, a toolkit for our members to use throughout their agencies and their communities. And again, in terms of advocacy, how do we get those who are in power to actually move in this area? And so part of that best practice kit, and what will follow from that is legislative talking points on how to educate those decision makers in this area. Our last bullet point in terms of advocacy is our quarterly teleconferences with licensing directors. NARA is fortunate to have access to licensing directors, those high-level decision makers across the states, and we do periodic calls with them on issues ranging from regulatory reform. And what we will now be moving to do is that when we do those conference calls, each of those conference calls will have the environmental health issue will be a specific agenda item. And so, again, this helps in terms of getting those who are actually the decision makers, those actually have more impact on the agencies, connections with providers, and so on, having them in the loop in terms of what's going on and pushing them to embrace this issue. Next slide, please. So we looked to see what sort of resources that we can develop based off of our collaboration, and we came up with two. One, we are in the process now of revamping the NARA website, and so this actually works well in terms of adding some more resources. And right now we have centers in terms of resources, information on child care, child welfare, and adult care. And so we have a subcommittee that's being developed right now that will look to develop specific resources and have them on our website in terms of environmental resources. So that's number one. And two, we have separate communities among our members, again, in those areas of child care, adult care, and child welfare, who communicate on a daily basis in terms of what's going on out there, questions, what sort of specific issues are being highlighted, and we will commit to creating a specific community which will be focused on environmental issues, issues in home care. So again, this further sort of pushes us in the direction of making this a priority. Next slide, please. But one of the things that we talked about among our executive committee and in the board is that these initial steps and these initial resources, we do not want these to be the end of our sort of involvement. We're now entering the process of our operational planning for 2015 in terms of what are going to be our sort of specific initiatives, and we wanted to be sure to have this issue highlighted not only for the purposes of this initiative, but something that carries forward in terms of NARA's future strategic planning. And so there are three specific areas in which we are looking to do this. One, as I mentioned earlier, we have an ad hoc committee to explore the different connections between not only NARA and the Children's Environmental Health Network, but other organizations in terms of how we can build support for this issue. And as I said before, NARA has, we look at the complete spectrum of human care. And so specifically, we're making an emphasis in terms of adult care, and one of the issues which we haven't seen addressed, at least with our organization, and we're looking at see what other organizations have done, is how this issue is highlighted in terms of adult care. And so our adult care committee, which is actually now doing a survey of adult care regulations across the country and in general, and so we'll pull some information from that and look to build some initiatives around that. And third, we will look to, we just completed our election process for our new leadership. As to say that our new president-elect will be the person who will be sort of driving this process in terms of the ad hoc and looking to adult care. And then the last sort of bullet point is, as I said, NARA has a strong commitment to research, and so though we've developed specific sort of items in the other areas that I spoke of earlier, we have yet to develop something in terms of environmental care issues, and so we have a pool of consultants which we're identifying to actually start to do research on that process. The other thing I want to highlight briefly is, what were our sort of challenges in terms of engaging this particular collaboration? And I would say they were two. Number one was the fact of getting their staff, myself and a member of my staff, up to speed, but also getting our board members up to speed in a fairly sort of condensed time frame. So that's been very intense, but it has produced some tangible outcomes. So that was number one. And then number two, as I said, ensuring that down the line that the particular momentum for this doesn't change with A, once this particular initiative is over, and then two, once our we have a new board coming on, so we wanted to build systems and processes which would carry this initiative forward. Next slide, please. That is my contact information if you have questions as NARA continues this journey. And at this moment, I'll pause to see whether there are any questions. Thank you very much.
Marcus, thank you so much. This is the time where we'll do just brief technical or clarifying questions. And there is one from Jamie, which is, what % of NARA's work is related to child care rather than adult out-of-home care?
I would say the vast majority, I would say 75% or more, is focused on child care and child welfare. And one of my goals in coming aboard on NARA was to raise that sort of focus on adult care. So, and again, with the survey being done by the adult care committee, we're moving towards that process. But historically, that has received as much focus with our members as the child care and child welfare areas have.
Great. And one last question here. Does the Best Practices Toolkit exist yet, or is it planned for the future, and what might be the expected release date if that's the case?
It is planned for the future. We are currently updating our best practices in general, and the process of doing that is just being an initiative. I think realistically, and we'll go through our board meetings, but we're talking about the latter part of 2015.
Wonderful. Thank you so much, Marcus.
Thank you, Nsé. Thank you so much.
Thanks. Our next presenter will be Colleen Tracy Haddad, who's the Executive Director for the Association of Early Learning Leaders. Prior to coming to the association, she was the Director of the Texas State University Child Development Lab School. She began her career in early childhood at Florida State University's Lab School and holds a bachelor's degree in child development. While working with the Florida State Center for Prevention and Early Intervention Policy, she completed her master's degree in early childhood education with a pre-K handicap endorsement. Colleen has been both a teacher and a director. Thank you, Colleen.
Thank you. Well, we are excited today to be a part of this project, and I'm going to tell you again, similar to Marcus, a little bit about our association. First, our association's our goal is to strengthen the knowledge, skills, and abilities of early care directors, owners, and emerging leaders, as well as other early learning professionals to ensure quality child care programs for young children. We do this through a variety of ways. Our focus on ways to help with networking, training and education, promoting program quality and accreditation, and access to resources. The services that we provide are a professional membership for directors, owners, administrators, and other professionals, as well as emerging leaders. We do offer the National Accreditation Commission for Early Care and Education Programs. We also have an annual national conference, How Successful Directors Lead, as well as our first annual Leadership Symposium this year. We provide a Professional Connections quarterly trade journal, and we do a Wednesday webinar series. And these are our primary services that we provide to directors of early care programs. I was excited to hear about the Children's Environmental Health Network collaboration because as part of our strategic plan, the National Accreditation Commission is under its standard review and for revisions. We do this approximately, a full review approximately every 5 years, and we have been going through the process of revisions now for a little over 6 months. And so the collaboration came at a time in which we were already going to be investigating the areas that we needed to improve our standards. And so that has been one of the primary focuses of the collaboration. But the nice part about the collaboration and being able to start immediately, because standard revision, as many of you may know, with any revisions can take time, we have been able to provide resources and webinars to our membership, which includes individual leaders who are going through our accreditation system, as well as leadership throughout the country. I'm going to tell you a little bit about the National Accreditation Commission, because that has been the primary focus of where the standards will, revisions will have the most impact as it relates to environmental health. Currently, the National Accreditation Commission has over 1,500 programs in 38 states, Washington, D.C., and the Department of Defense overseas. The states that are starred on the screen are states in which we are part of some type of quality improvement process. With the invention of quality rating scales in different states, we may be at a different part of that new process, as many states have the Race to the Top grant. We have approximately a little over 975 currently accredited programs, with a little over 55% of those having gone through our accreditation process more than once. And so we have had a number of programs go through this process. The National Accreditation Commission did start in the mid-1990s and has grown over time. And our states that we have our largest impact are our centers that have been accredited 5 or more times are Illinois, Virginia, Florida, Texas, and Arizona. So accreditation is a 3-step process for us. The first step in the process is the self-study. Programs must engage in self-study for a minimum of 6 months, and they have up to 2 years to complete their self-study process. The next step is the validation or the verification visit. Once programs feel that they have overall compliance with our standards and that they are ready to have a verification visit, then they will submit paperwork to the accreditation office to be reviewed. If they are determined ready for a visit, then we will schedule an on-site visit to determine compliance with our standards. Once they have a visit, the third step, and actually probably should be divided into a 4th step, is the review and the decision. But one key part about our accreditation system is we really do focus on being an ongoing quality improvement process. So there is a focus on ongoing compliance. The accreditation is valid for 3 years, and so and annual reports are due on the anniversary of their award. On the 2nd anniversary, they will turn in their 2nd annual report, and once it's received, they're automatically re-enrolled into the self-study process. And if they choose to continue with us, then they must submit a new request for a validation visit prior to their expiration of year 3. Our standards are divided into 6 component areas: administration, family engagement, health and safety, which are part of the tool of the administrator's report, curriculum, interactions, and classroom health and safety, which are part of our classroom observation tool. In the collaboration, we focus on primarily the component areas of health and safety and classroom health and safety, but we did want to make sure that so that environmental health was incorporated throughout the program, that there are also other standards that are incorporate some of the new recommendations for improvement that we are going to be recommending to our council. We have a number of ways that we validate to ensure that the standards are being implemented, and we did incorporate these methods when reviewing indicators that have to do with environmental health. Those ways are document review, observation, staff survey, parent survey, and interview. So for those of you who may not be familiar with our accreditation system, this is a standard that is a sample out of the current manual, and this is from the classroom observation, the first standard in classroom health and safety. And so the standard is health practices are implemented throughout the day. And then how we verify our standards, we call them indicators. And each standard will have its own set of indicators. And next to the indicators, just so you can see, we tell the program as well as the verifier how that indicator should be verified. Throughout the self-study process, our programs will create a timeline. They will use an administrator's report and organize documentation throughout that administrator's report. They have a classroom observation tool in which they make a set for each classroom, one set that the director completes observations, and the director is required to do formal observations, and then a set for the teacher to do a self-assessment and with her teaching team or his teaching team. They are also required to develop training plans and complete training logs, and these training plans should be based on areas in which they see they need improvement, both in the administrator's report, such as creating policies and procedures, as well as the implementation of those policies and procedures that they observe in the classroom that in areas they may need improvement. They also will conduct a staff survey and a parent survey. They're required to do this once, but it is recommended that they somewhat do a pre-survey, and then after they've gone through a period of their self-study and made improvements, that they do a post-survey. And then once they feel that they have all areas ready, then they will prepare their request for validation visit. So I wanted to tell you just a little bit more about our collaboration. We've been working closely with the Children's Environmental Health Network to look at our standards to see how we could just integrate some indicators within already existing standards. There were some areas in which we did not have a standard at all that were deemed important. And then there were other areas that were very limited where we might just need to add an indicator. So in some cases we changed the standard altogether, and I'm going to show you an example of that. And then in other cases we're just adding indicators. The process for our revisions are quite complex, and so at this point in time, these are the recommendations that we are going to be submitting first to our Policy Council for review, as well as to outside review, and there will be a number of revisions. So at this point in time, these are some recommendations. Additionally, our outside review will incorporate some of our currently accredited programs and directors, so we get an option for feedback to make sure that the incorporation of the environmental health standards and indicators fit well within the entire process of going through the accreditation. So this is one of our current standards. All areas used by children are well lit, ventilated, and maintained at a comfortable temperature. Currently, there were no indicators. The recommendation actually is quite extensive on this one, and it is steps are taken to ensure that indoor and outdoor air quality is maintained. But as you can see, and I'm just going to point out a few indicators, many of the things the program is already doing, but one of the intents is to help educate our programs to ensure what is the correct temperature to be maintained rather than it says comfortable. So we have a draft-free temperature of 68 to 75 during the winter months and a draft-free temperature of 74 to 82 maintained during the summer months. Conditions that lead to excess moisture are avoided to prevent the growth of mold. And then smoking is not permitted anywhere in the facility's premises, indoor and outdoor, or inside of children. So it just gives us a few additional indicators for programs to implement to ensure that both their indoor and their outdoor air quality is maintained. In order to support in this process, we also developed the survey questions that would go along with those indicators, as well as glossary terms. Our glossary is used by our programs really as the key to how certain jargon within our standards. So some of the glossary terms may be national standards, such as the Air Quality Index, where, especially if it's abbreviated AQI, a common director may not understand what that means. So in our glossary, we will make sure that we define it as well as give them a website resource for them to be able to access. So the glossary is really a support of the standards. So in this standard, we're recommending the glossary terms of the carbon monoxide detectors as well as air quality index. For the staff and parent survey questions, they're a way to support that the policies, procedures, and practices are being implemented and that the staff and parents are aware of them. So the first question are, steps are taken to monitor air quality and all areas used by children are well ventilated and maintained at a comfortable temperature. And the parent survey would be, I'm aware of the program's anti-idling policy and take steps to comply. We did have one area that we had not addressed at all, and that was pest management. And so we are going to propose that we have a new standard on integrated pest management techniques are used to control pests, including insects, weeds, and vermin. Again, many programs may be doing these items already because integrated pest management, although may sound complicated, is really just taking basic steps to ensure that you are avoiding attracting pests, and so such as keeping your indoor and outdoor garbage covered, and then other things such as using non-toxic techniques to control pests both indoors and outdoors. We will have a survey question for these as well. The staff survey question is least toxic strategies to control pests are used and garbage bins remain covered at all times. And then the parent survey is that garbage bins remain covered at all times. And then we do have a very detailed glossary term that will help them know what it means to have integrated pest management, because there are other steps such as cleaning up food and drink spills right away, not leaving dirty dishes in the sink, storing food tightly in containers, fixing all leaks. We have standards that may relate to these items and are indicators and other standards. And so it is important to make sure that we only have one indicator, so those indicators may be found someplace else. The other two things I wanted just to point out quickly is that we included environmental health policies under our administration underwear and procedures. So A6 is written operating procedures and what procedures they'll take to make sure they're monitoring air quality, as well as adding them in our family engagement section to parent policies and procedures, such as adding the anti-idling policy to the parent handbook. But most importantly and lastly, the ways we have currently that you can access some resources is that we have published the EcoHealthy checklist in our Tools of the Trade Professional Connections. We have been publishing the fact sheets quarterly in our trade journal, and those are accessible to our members. We have been putting in our blogs online and on our website so that they have constant access, as well as we are offering environmental health webinars so that we can, before our standards are released, prepare everyone for the simple steps that they can take to immediately start looking at environmental health in their programs. Thank you. Oh, and then contact information.
Thank you so much, Colleen. Very helpful information. We do have one question here asking, are the standards and indicator checklists available publicly, for example, on a website, or are they only for those organizations already undergoing the accreditation process?
So we do have all of our standards on our website under our accreditation tab. You can also specifically purchase a manual if you want to in advance. You do not have to be enrolled in the process to get the complete tool and all of the indicators. As far as the specific recommended improvements, because they're still in their early phase and have not gone to the council, those won't be available for review until they are reviewed by the council.
Okay, thank you. And we have another one here. Have you identified the cost of implementing these standards for your member groups? This is from Steve.
So we have been taking very specific steps for each one of the indicators to look at and make sure that they are not cost prohibitive for programs. Luckily, we were using the Children's Eco-Healthy Checklist, in which they have well over 1,000 programs that have participated, both family home providers as well as licensed child care providers. And so the indicators that we're using are similar to, just worded within our own guidelines. And so yes, we are taking a look at those costs. And I will tell you that will also be one of the roles of the council. On our council, we have both academics as well as practitioners and owners of early learning programs. And then it will additionally go out. Most of the indicators may already be being required by certain state child care licensing agencies. And so we're really looking at ways to implement pretty simple items. The two major standards that we're recommending actually were probably shown on the screen. Others are just simple things such as using cold water instead of hot water to prevent lead exposure. And so there's a lot of things that are mostly educational. So we're excited about those and getting them started immediately.
Great. Thank you so much, Colleen. And at this time, we're going to open our second and final poll. So if you could just take maybe the next 45 seconds or less to quickly answer the question, that would be helpful. Okay, we're going to close the poll. And here are the quick results. The question was, do you use the Caring for Our Children 3rd edition standards in your work? And I have a screen covering my percentage. There we go. 36% indicated always, 23% indicated sometimes, which I think are favorable. Only 2% said rarely, and 39% did say never. So our hope is that this next presentation will introduce this wonderful resource to you if you don't already know about it, and or remind you about it. Our final speaker is Jean Chimino. She's a public health professional who focuses on early childhood health and safety. She began her career in 2003 as the curriculum planner for the National Training Institute for Child Care Health Consultants, otherwise known as NTI, at the University of North Carolina at Chapel Hill, where she developed and revised Train the Trainer curriculum for state-level child care consultants. Jean currently works at the National Resource Center for Health and Safety in Child Care and Early Education, otherwise known as NRC. As a content manager for the Caring for Our Children National Health and Safety Standards. The NRC is a federally funded maternal child health bureau program administered under the direction of Dr. Marilyn Krychek at the University of Colorado College of Nursing. Thank you, Jean.
Thank you, Nsé. Well, we at the NRC are very excited to be on this webinar, and we had a wonderful experience being part of the Health in All Policies initiative. I'm going to follow the same format used by Marcus and Tracy, explain a little bit about the NRC, and then move on to what product we produced as a result of our collaboration with the Children's Environmental Health Network. This is just an overview of our mission. We've been around since 1995, and as Nsé said, we're a federally funded project from the Maternal Child Health Bureau. We're administered out of the University of Colorado College of Nursing. And as we know, 11 million children under the age of 5 in the U.S. attend early care and education programs, and this is data that came from Child Care Aware in 2014. And so our mission is to improve the quality of out-of-home child care and early education programs and to support the health and safety of the children they serve. Next slide, please. We follow this mission by supporting a variety of audiences and stakeholders. As you can see noted on this slide, it really runs the gamut in terms of the populations that we serve. And we have resources for and relationships with all of these groups. Next slide, thank you. Caring for Our Children is our primary resource. It is a collection of 686 National Health and Safety Performance Standards for early care and education programs. It's co-published by the American Academy of Pediatrics, the American Public Health Association, and the NRC. In 1992, that was our first edition of Caring for Our Children, followed by 2000 was our second edition, and our third edition revision was completed in June 2011. It was a 4-year revision process, and the standards are not developed or revised solely by the NRC or our partners, our national partners that I mentioned. We really partner with a wide variety of nationwide experts, and you'll see there that we had 10 technical panels, which I'll talk a little bit more about in the following slides. It's important to note that each standard follows the same format. We have our standard language, then we have the rationale behind that standard, followed by any comments that might be necessary to back up the standard further. And then the type of facility is specific to each standard, and we really focus on 3 types of facilities: center, small family child care home, and the large family child care home. And then we note any related standards as well as references that further support that standard. Next slide. Caring for Our Children is a nationally recognized resource. In earlier editions, when child care and early care and education programs was more limited, the standards really derived from expert consensus. But as we know, and thankfully, there's been a lot more research over the last 15, 20 years that's been conducted in child care. And so there is more evidence-based material to back up the standards that are part of Caring for Our Children. An important thing to know about Caring for Our Children is that they are voluntary standards of best practices. They are not regulations, but they have been used by many to produce model regulations and policies for health and safety, and that's really one of the main purposes of Caring for Our Children. As I noted earlier, the standards are not developed or revised in a silo. We collaborate with 4 different groups, very important groups. Each of them are critical in the standards. The first are our national partners that I mentioned earlier. The second group is a steering committee that we have, where we have a representative from each of those national partners in Group 1 that are part of our steering committee, and we communicate with them regularly on, even now 3 years after the 3rd edition has come out, on revisions and updates to standards that are necessary. The third group is we have technical panels that are arranged by topics. For example, we have an environmental health technical panel, and each of those panels includes anywhere from 6 to 8 experts that can provide information to us on the best research and best practices out there that are relative to that topic area for a standard. We also have an injury prevention standard, a technical panel, child abuse technical panel, etc. And then our group 4 is our stakeholders, and this group really represents all of the groups that we serve, as I discussed at a previous slide. In that group, we've had parents and guardians, early care and education programs, caregivers, teachers, health professionals, regulators, licensors, etc. So it really is a partnered effort to produce and revise these standards. Up until 2 years ago, in addition to the print copy of Caring for Our Children, we had a PDF available online. But now we have a searchable database, which we've gotten lots of positive feedback from our stakeholders on the use of our database. That's our website there at the bottom. You can go directly to our database, and you can search by content area. So I did a quick search prior to this webinar on lead, for example, a really important environmental health topic. And the database showed 197 results. And these are all results coming directly from Caring for Our Children. So we reference lead 197 ways in Caring for Our Children, which is pretty spectacular. And then air quality, I did another test on that, and that came back with 53 results. So we really encourage you to use our database if you're one of those folks that uses our the Caring for Our Children standards as mentioned in the poll earlier, if you're not using the database, I encourage you to do so. And for those of you who have not used Caring for Our Children, if you just kind of want to poke around and see how we address different health and safety issues, I encourage you to go there. If you have any questions about how to use the database or need help finding related standards, you'll see our 1-800 number, which is at the bottom left corner of the screen. You can call us there anytime, as well as email us at info@nrckids.org. In addition to the larger Caring for Our Children document that includes all of the standards, we have compiled several special collections since the 3rd edition came out, and these include those you see on the current slide. I wanted to highlight two more recent collections. The one in the top left is Stepping Stones to Caring for Our Children, and this was created last year and represents those 138 essential standards that when practiced could prevent serious adverse outcomes to children in early care settings. And then the bottom right there is our Caring for Infants and Toddlers in Early Care and Education. This was just released in March, and as the title infers, it represents those standards most applicable to the infant and toddler population. This is just a screenshot of our website, and if you notice that the banner there, products, is where you'll find all of our resources. Okay, and this is something we're really excited about, our brand new collection, which is the result of our collaboration with the Children's Environmental Health Network under the Health in All Policies initiative. We have a long-standing relationship with CEHN, and we're excited to apply to collaborate with them here. One thing I do want to note is just released today on our website, we have an accompanying compliance comparison checklist that goes with this special collection, which I'm going to go into in more detail in the coming slides. And that checklist is formatted for computers, tablets, and smartphones. So I encourage you to go on our website under this environmental health page and find that there. Next slide, please. Thank you. So our brand new collection, Environmental Health in Early Care and Education, this collection was inspired by Caring for Our Children 3rd edition, our comprehensive approach to environmental health. On previous editions of Caring for Our Children, we didn't have as comprehensive of an approach to environmental health. So with 3rd edition, that was a big change. And so it includes new and expanded standards addressing this vital topic. And so that really was a great segue for us to then pull those environmental health standards out specifically and have our own collection. Our intended audience is widespread, much like the folks who we work with. And these standards are applicable for all children, including children with special health care needs. I did just want to give an example of some standards. Very similar to the standards that Tracy mentioned on fresh air and temperature, we do have standards specifically on those topics. And also, Tracy, I wanted to let you know we have a standard 5.2.8.1 as our integrated pest management standard. So I encourage folks to look there and see what CFOC says on that. Another example I wanted to give about environmental health standard is our maintenance of air filters, and this just sort of backs up some of the things that Tracy was talking about. Specifically, our standard says that filters in forced air heating and cooling system equipment should be checked and cleaned or replaced according to the manufacturer's instructions on a regular basis, at least every 3 months. So that's an example of an environmental health standard from this collection. I'm going to talk a little bit about how we developed this special collection. Of course, we worked with CEHN to develop a project timeline. And internally at the NRC, we created our initial list of Caring for Our Children standards, which ones would be part of this collection. As we all know, environmental health is a term with many definitions, and truly the vast majority of Caring for Our Children 3rd edition standards really have the potential to influence the environment and environmental health of an early child care and education setting. So we looked at this one specific question, and Carol Strobel from CEHN really helped us refine this. If this standard was not followed, would the resulting harm be consistent would the resulting harm be considered the result of environmental health incident, a physical injury, or an infectious agent? And if it met that need for an environmental health incident, then we included it in this collection. We worked specifically with the Caring for Our Children 3rd Edition Environmental Health Technical Panel Chair and our steering committee in the initial review of the standards that we chose. We also did an extensive stakeholder review process, it was really important for them in the review process to look at that question that I just mentioned, and that really helped them decide, is this collection comprehensive, including everything we need to include in an environmental health collection. We worked very tightly with CEHN to develop the introduction, and then we discussed the organization of the collection with Carol at CEHN to make sure that it flowed well and that the topic areas were accurate. And then, of course, we incorporated the stakeholder review feedback into the final document. We also worked closely with our steering committee on the reviewed collection, incorporated their feedback into the final document, and then we were very happy to post the document when we were expecting, which was July 31st, and we marketed it via our social media, our listserv, and every month we have a What's New where we highlight new resources from the NRC, and so we featured it there. And we also collaborated with the Children's Environmental Health Network to get the word out about our new collection. Of course, with any new project, we faced our challenges. Initially, we had planned to update Caring for Our Children 3rd Edition environmental health related standards based on new research, and through our collaboration with Carol and Hester, we know that there is some research out there that would warrant some updates to Caring for Our Children standards. This, unfortunately, is a lengthy process, and as it should be, because it involves the review of multiple content experts. And so we would have had to use experts from the Children's Environmental Health Network Scientific Committee, as well as our Environmental Health Technical Panel and our Steering Committee. And truthfully, if we were working on that, we probably would still be doing it now. That did, however, it did inform a change to comments in our standard 5.2.9.13, which is testing for lead, and we did make that change to a required measurement in our comments section. So we were happy to be able to do that. Another challenge was, as I mentioned earlier, sort of how we defined environmental health and how we, what marker we used to determine which standards should be involved. There were a lot of different views and opinions amongst our reviewers about, how we should focus this collection. And ultimately, we settled on a more broad definition of environmental health with the purpose of being more inclusive. And just another challenge that we faced was the time and availability of viewers. We really had a fantastic group of expert reviewers, but because it was summertime, of course, as people should, they were on vacation, so there were some folks who we couldn't utilize in our review process. Thankfully, we had a lot of successes. Of course, we think that collaborating with EcoHealthy Childcare and the CEHN staff was a huge success for us. They have a tremendous amount of expertise and resources that were very helpful in the development of this collection. We also networked with both of our organizations to expand the reach of the collection. And of course, we look forward to future collaboration opportunities. And we also completed the collection on time, which is always a good feeling. We just want to give special thanks to our national partners, AAP and APHA, as well as our funders, the Maternal and Child Health Bureau. We had 20 individuals from 17 organizations who were our stakeholder reviewers, and we certainly appreciate all the work they put into this. EcoHealthy Childcare and CEHN, and forgive me, CDC should be on there as well for being the folks who really enabled this collaboration, and all of you for joining us today.
Thank you so much, Jean. Fantastic. We do have one initial question, and the question is the NRC funding from HRSA?
Yes, MCHB is under HRSA. Yes.
Thank you. At this time, we could actually open it up to questions for all of our speakers, and certainly if there's any more for Jean, please post your questions now and we will address them accordingly. Any questions for the panelists? Okay. Well, on that note, could we have next slide, please? I just have some closing remarks. Just want to note again that this presentation was supported by a cooperative agreement by the Centers for Disease Control and Prevention to the Children's Environmental Health Network, and its contents are solely the responsibility of authors and do not necessarily represent the official views of the CDC. I just do need to put that there. And actually, there is a question that came in, so I do want to go back to that a few questions actually before I finish here. One question from Nancy is, in Washington State, we are very concerned with the change in concentration recommended for bleach for disinfection. So it's a statement, but I don't know if anyone wants to address the overall concern.
This is Linda Sakoviak, also from the NRC. I'm here partnering with Jean on this presentation. I'm working right now very closely with the state of Washington with a work group there and looking at the work they're doing to try to determine from the different regulators, EPA, the different government agencies, what would be the best bleach disinfection solution to be used in the child care setting. As you may imagine, it's been a very long and laborious process. There's a lot of technical information involved, and again, the NRC partnering with the work group, looking at the work they've been doing, we will take then the information that they have gleaned and look at this particular standard and how it affects our Appendix J in caring for our children to determine then how we will approach our steering committee to see if any edits or changes need to be made to that standard. So I hope that gives you a little preview. It's definitely coming.
Thank you. And another question here is the publication from NRC in print or just online?
At this point in time, the publication is only online, available online. You're certainly allowed to download it and access it that way.
Great, thank you. Okay, next slide, please. Again, we want to thank all of our partners, today's fantastic speakers, the CDC, and all of you for taking a good hour plus out of your time. I do want to note that soon after this webinar ends, you will be receiving in your email a SurveyMonkey evaluation of this webinar. We really do appreciate your feedback for future webinars and educational forums that all of us participate in. And you will also be receiving a Dropbox email link to the PowerPoint slides for those of you that may want to utilize those or look at those a little further and or to contact any of the presenters. You'll have all the contact information there right in front of you. And here is all of our contact information. We'll take a minute if you'd like to jot them down, or at least the web addresses and phone numbers. We are certainly all here for you. We very much want to be able to support other organizations that are trying their best to model some best practices and incorporate environmental health and safety practices into the work that you do. And so with that, I'd like to call the webinar to a close. And again, thank all of you. Thank you to our fantastic presenters. And I wish you all a fantastic rest of your day.